Gwinnett Medical Center has an incredible vision for the future, a vision that will transform healthcare in our community and ensure that the very best care is available for every patient we serve. That vision is called Project PATH. The next component of Project PATH is the expansion of our cardiovascular services. Open heart services are essential for a community's well-being. Now, the need is stronger than ever. Join us to ensure that Gwinnett Medical Center is the hospital you deserve.
One of the things that are lacking in this county is the fact that we're not an all-service open heart or cardiovascular facility, and we are desperately lacking the ability to treat patients who come in with acute heart attacks. We are unable to treat people who require open heart surgery in this county due to the fact that we do not currently have an open heart facility.
We've got some premier heart specialists in Gwinnett, but we don't have the facility. And there's no reason for us not to have the facility. We're the largest county in the country without open heart surgery. And there's no reason in the world for us to not have it.
With an acute heart attack patient, if you can provide an acute intervention with acute cardiac catheterization or an angioplasty or stenting, then you can provide more optimal care. Some of those patients are going to need heart surgery, and there are going to be times when trauma patients are also going to need the support of an open heart program.
It appeared that the main artery into my heart was almost 100% blocked, and as they say, it was about to go. And I was rushed immediately into surgery. My timeline would have been 7:30 in the morning. I would have been in transit to St. Joe for surgery, and needless to say, I would not have made it.
Open heart is very, it's at the heart of one of the causes for our family, in that my father, when I was in college, had a heart attack while he was at work, and his doctor was in Atlanta. He called my mother and had my mother pick him up at work and drive to Atlanta. He had a heart attack on 85 before he got to Piedmont Hospital.
In April of 2007, I had a heart attack. I was treated excellently in Gwinnett County Medical Center's emergency room, but was life-flighted to St. Joseph's Hospital to have the further heart procedures done. I had a stent put in, and I was just very fortunate to be able to be life-flighted down to St. Joseph's. But I'm thinking about those citizens when the weather is bad and the traffic is bad, and you're caught up in that moment of, wondering whether you're going to make it or not. Having open heart surgery in Lawrenceville would have eliminated all of that. We could have provided those excellent heart services at Gwinnett Medical Center, and lives will be saved.
I am often reminded of a gentleman who really was relatively healthy in his early 40s, who was seen in our facility in Duluth. We made all the arrangements to transfer him to another facility that could do emergent angioplasty. He left talking to us, smiling, but still having pain, and unfortunately, in the parking lot of the receiving facility, suffered a cardiac arrest, and they were not able to revive him. And I feel as certain as I'm certain about anything that patient, who's just one of many, would have survived if we would have had angioplasty and open heart capability at Gwinnett Medical Center.
The reason I suppose I'm so passionate about Gwinnett Medical Center having open heart surgery is because of personal family experience. At age 53, my father died of a massive heart attack while driving to work. Had the hospital been closer, perhaps he would still be alive. In addition, my sister had a heart attack at age 53 out in San Diego, but she was very close to a hospital, received very good care, and she is still with us and doing very well.
Open heart surgery is a normal and very important part of healthcare today, and Gwinnett County needs to take the next step. To build the next level here, we're going to need continued citizen involvement. We're going to need philanthropy. We're going to need all kinds of contributions in talent, in money, and effort by the citizens of Gwinnett. That's the way The citizens always get what they want, is they dive in themselves, they make commitments, they make personal judgments. It's important, and they deliver.
You know, philanthropy is one of the most important things in our future. It's the most efficient way of getting money for the needed expansion that we have here. So everybody's dollar helps, and everybody's dollar counts. And so we're going to be focusing a lot of our efforts in the future on philanthropy.
When someone participates in helping us make this vision a reality, especially through philanthropy, they're literally touching the future. They're changing lives in the future. What's so beautiful about it is they're willing to sacrifice now to make sure that the tomorrow is bright for their children, their grandchildren, and people they'll never even see or meet. That's what's beautiful about philanthropy, and it's what's needed now for the people in the leadership of this community.
I just figured somebody's got to be a pace setter, and Sandra and I just decided that we have been blessed so much, and God has protected us and looked after us, and we want to do something to help maybe open other people's hearts that they would start giving to such a great program.
It's really not about us, it is about other people when you give. But in order to make a statement, we both decided, you know, we can do this. We have wonderful doctors and wonderful staffs at Gwinnett Medical, and this would just make it even better and broader. And it's just the beginning of our hospital. And after this, and once we have open heart surgery, you know, we'll move on to something else at this hospital.
It's not about what we get. It's about what we give and what we do with what we have. And I think that's the reason Sandra and I made this decision.
Absolutely.
We all live here, we work here, we play here, we shop here, we have our grandchildren here, and we want life to be the best it can be. And with all of us pulling together and really, really working at this and staying focused, we can make this happen.
Open Heart is in our hands, and we need to make it happen.
To find out more about the Open Heart Initiative and how you can help, please visit our website at gwinnettmedicalcenter.org.